is 22 News in Focus.
Welcome to 22 News in Focus. I'm Ciara Speller. The Massachusetts legislature is considering a bill that would allow terminally ill patients the option to request life-ending medications, known as the Massachusetts End-of-Life Options Act. The idea behind an aid in dying law is to help relieve long-term pain and suffering. Currently, 9 states and Washington, D.C. offer physician-assisted death. And joining me now are supporters of this bill. We have John Berkowitz, Director of Western Mass Death with Dignity, Dr. Kate Atkinson, a family physician from Amherst, and Dr. Shelley Berkowitz, also a family physician. Thank you all for being here with us today. Let's start with some background. The movement for a law in Massachusetts actually began 10 years ago. John, I want to begin with you. Just tell us about the history of this legislation and where does it stand right now?
Sure. As I understand, I've only been involved in trying to get this option passed for Massachusetts, making our state the 10th one to offer this option to its terminally ill citizens for 3 years. But at least 10 or 12 years ago, a representative in the legislature named Louis Kafka from Stoughton, Mass., he introduced the bill because he saw one of his closest friends die of pancreatic cancer and he was unable to help him. He said, I want something to be done, that the pain isn't being managed well enough by the hospital or hospice, wherever he was. And it was just a difficult situation. And he had to face his friend going that way. And ever since, he's been sponsoring this bill, and it's got more support 10 years later than ever before.
And tell us about Western Mass Death with Dignity. What is your platform?
Sure. We educate the public about how well this law is working in the other 9 states that have either passed this law. One of them passed it by the Supreme Court, not by the legislature, but it's 9 states now over the last 23 years, plus Washington, D.C. City Council of Washington, D.C. passed it. So they have terminally ill people there have the option of choosing, as long as they're proven terminally ill by 2 different doctors 2 weeks apart, because there are safeguards built into this bill to make sure that nobody does it impulsively. Anyway, they can go to they can get a prescription from their doctor, they get the medication, and the data shows that only 2/3 of the people that get the medication in any state, whether it's Washington, D.C. or Oregon or Maine that just passed it a year ago, only 2/3 end up using it. 1/3 don't even take it, even though they could. It just gives them that much comfort and security knowing they have it.
All right, thank you, John. I want to bring in Dr. Atkinson now. Dr. Atkinson, what compelled you to become a supporter of this law?
Well, not everybody knows, but before I went to medical school, I was an RN, and I worked as an oncology nurse for several years and then as a hospice nurse. So I took care of a lot of patients at different stages of disease and suffering, and including dying. Then when I went to medical school, I found that I had to do family medicine because I love the wraparound of taking care of people from when they're born to when they die. And I know the families and the patients better than anybody. And it doesn't feel fair at all that when someone's at the end of their life, they don't feel like they can come talk to me. I've had patients who said, I can't tell you how I'm feeling because it's illegal and you can't help me. And I want them to be able to come talk to me. I mean, we need to have this dialogue. I need to still be a member of the team. And so the times that I've had these conversations with patients, I felt very torn. And there's just no doubt in my mind that this needs to be in my tool belt of things that we can offer patients.
And Dr. Berkowitz, let's bring you in now. Why did you decide to become involved?
Well, first of all, Ciara, thank you for having us here. And there's so much going on in the world right now, not just Massachusetts, because of the pandemic and economic conditions that have affected, that are barriers to the rights of people in dignity in life. And this bill is about the right of a person to have dignity in their own death. So I decided to become involved in this for the same reason that most people would, which is personal experience. And my personal and professional life during that, I have witnessed and been part of the end-of-life experience for many people, both patients and family, for 35 years. I've worked in all settings, hospitals, nursing homes, private practice. like Kate now. I have seen good and peaceful deaths, but I've also unfortunately seen painful and uncomfortable deaths. I have felt powerless in those times, that despite my best efforts and efforts of hospice and palliative care to try and control and prevent the pain and suffering, witnessing the deaths of both of my parents, each was different but very painful and not comfortable in the end. That powerlessness really was the tool that made me want to have this bill passed, so that people have more options to prevent pain and suffering at the end of their life.
All right, thank you. John, I'd like to bring you back in. Could you talk about what specifically is in the law and which of our local legislators are in support of this measure?
Sure. As I mentioned, there are a number of important safeguards built into the law. Because this law has existed in our state, has been in the legislature for 10 years. Other states, it takes a while to pass too. Anyway, it's been tweaked, it's been added to, it's been amended. They keep adding more and more safeguards to make sure that no vulnerable person, dying person, a frail elder, a person with disabilities, a member of a minority, low-income person, nobody can be forced or coerced or abused into ending their life when they don't really want to. And the facts and the data show that that hasn't happened in any other state. So I'm very satisfied. I wouldn't be able to work in this, I'm not paid, but I wouldn't be the director of an organization pushing for making Massachusetts the 10th state unless I was convinced that this is safe and the safeguards that are built into the bill. Just one quick example, the underlying cause of death on the death certificate must say cancer or heart disease, whatever that person, not suicide. That gets into some questions we're going to get into later. But the reason for that is that way, a life insurance policy would not be able to say, well, I'm sorry, we don't pay out for somebody who committed suicide. Well, this is not suicide. This is death by cancer, but using medical aid and dying at the end. So that's an example of a safeguard.
Thank you so much for your analysis. And after the break, we'll learn more about what is covered in the End of Life Options Act. You're watching 22 News in Focus.